The way to treat addiction that has the most evidence to support it is pharmacological therapy. At least that's a major component of treatment. And one of the issues with especially using opioids IV or injecting them is that it comes along with a lot of collateral damage. So HIV infection, bacterial infection of the blood from reusing needles and using dirty needles. And one of the ideas of treatment for opioid addiction is to substitute a safer version of the drugs that were being abused. And methadone is an opioid by itself, but it lasts for a very long time in your body. And one of the ideas with methadone is you take it at a dose that isn't so high that you get euphoria from it, but you never let it get so low that you experience withdrawal. And because it lasts so long in the body, it prevents these withdrawal effects from occurring. And so you can essentially take it once a day. Again, the dosage is figured out for you at the clinic to make sure you're not getting high from it, but that it's at a high enough concentration in your blood that you don't get withdrawal. So it hopefully will satisfy the cravings and prevent withdrawal from taking place. Also, it's a pure drug. You're taking it orally usually, so you're not using needles, so it's a much safer alternative. One of the other common pharmacological interventions is to use a drug called Suboxone. And the active ingredient in Suboxone is another opioid, but the interesting thing about it is that we call it a partial agonist. What does that mean? Well, when it binds to targets in the brain that things like fentanyl usually bind to, it doesn't activate these targets 100%. So it just partially activates these targets. So what does that mean for you as a user? Again, you're likely not going to get the same kind of euphoria or high, but those targets are activated enough so that you don't get withdrawal. And Suboxone is thought to be a safer alternative to methadone because it doesn't activate these targets in your brain to 100% of their capacity. So we say it has a ceiling effect, which means that even if you took more than you should, more than your physician recommends, there's less danger of overdose. So it's harder to get the respiratory depression with Suboxone compared to methadone. The other interesting thing about Suboxone is that it has another ingredient in it. And if you inject or try to inject, which would be an abuse of the drug, if you try to inject it, this other ingredient will prevent the active ingredient of the drug from binding to the targets. So if you try to inject it to get high, it will not happen. So it's kind of a clever mixture of two drugs. If you take it the way you're supposed to, it works fine. If you try to abuse it by injecting it, this other component will prevent the opioid in Suboxone from binding to receptors in your brain and you won't get high.